heart disease. So this was the most requested topic from our little survey, and probably the last talk for a little while because house is going on the market. So I need to have a little downtime away from my computer. Okay, so we're going to start with prayer, and then we'll jump right in. Dear Heavenly Father, I pray that you will please be with us today as we learn more about you and your creation and the things that can keep us healthy. In your name, amen. Okay, so heart disease is a very broad topic name, and so I wanted to kind of give you how it's defined and what the four big categories are. Coronary artery disease, you can actually hear these terms kind of thrown out there we all like acronyms in medicine for some reason. So CAD, you can actually, this can be diagnosed by imaging studies, can tell you how you have calcification in your coronary arteries, and we can say you have CAD by that, or by cardiac CAS, where they put dye in your veins and look to see how blocked they are. Usually about 1/4 of your heart attacks, the first one is fatal. So fatal or non-fatal heart attacks are part of that category of CAD. Next big category is cerebral vascular disease, which is your strokes. Again, those, a smaller proportion are fatal the first time. Then you've got peripheral artery disease. So this is anything that's in your peripheral arteries. So legs, carotids, where you hear about FIM-POP bypasses and things like that, where they have stents put in their legs. So it really just depends on your blood vessels and which vessels get blocked first. The big ones in your legs sometimes take longer than the smaller ones in your heart, which take longer sometimes than the ones in your brain and in your neck. But it really depends on your anatomy, and vessels the blood flow will be a little different for different people. So that varies normally. And then the last category is the aortic aneurysm. So you've got abdominal ones, or you've got thoracic ones that are up closer to your aortic arch. So these we start screening for if you're a smoker, or if you've got a family history, you had a higher risk for those. So next slide. So here are some of so these are big enough, I guess, to see where the main areas that are hit with coronary artery disease and the things that they affect. So legs, stroke, it really just depends on which part of your body is affected, which vessels are affected, as to where you get the side effects of coronary or heart disease, okay? All right, so some of the risk factors. We talked before about hypertension and how that's defined. Really, 120 over 80 is considered borderline hypertension now. And optimal, which is normal, the closer to normal, which is 100 to 110, like we saw in those last videos, the slower the progression of disease for heart disease, for kidney disease, the closer to normal. They allow you up to 130 if you're diabetic, or if you have heart disease, stroke, they allow it up to that. If you don't have any chronic health problems, they usually allow you a little higher, up to 140. And they change based on a committee every few years, which, the studies have really shown the more medicines that you require to keep things normal, you tend to have more problems. So when you have to rely on medications keeping you normal instead of getting normal by lifestyle factors, you actually have you're at risk for the side effects of the medicines much more, which is why lifestyle changes are always recommended first. However, most patients coming in to see me don't want to do lifestyle. They just say, give me a pill. So risk factors, any blood pressure really over 130 is considered a risk factor for you developing atherosclerotic cardiovascular disease, which is that other big term. Diabetes, normal is less than 5.7, okay? So in that 5.7 to 6.4, you're considered pre-diabetic, which means you're already at risk, which means you're already having insulin resistance, which is just a fancy way of saying your body is already having problems dealing with the amount of food that you're eating that's requesting excess insulin. Fat gets you there quicker than sugar by far. So you can actually pay medical students to be guinea pigs and turn them diabetic very rapidly by feeding them high-fat diets. And it takes a lot longer for sugar. Okay? So high cholesterol, people that follow a fairly healthy diet, their cholesterols usually don't get over about 150. The cholesterol normal range is based on the country that you live in and the society that you live in. So for us, normal includes the majority of people dying of heart disease. Okay? So when your doctor tells you you're normal, that's not always a good thing. So for you to know the numbers and look at things yourself is probably a little bit better. Premature heart disease. So if you've got somebody that's had a heart attack in their 50s, you're at a higher risk. So anything really over 55 is not considered premature heart disease. Lifestyle factors. So diet definitely affects it. Lack of exercise. They say that being sedentary is the new smoking. It actually kind of causes you to have the same risk factors as somebody that's a smoker when you're sedentary. A body mass index above 30. Normal is considered up to 25. Overweight is 25.1 up to 29.9. And obesity has multiple categories up to 50, 55. I've seen some patients. Alcohol use. So alcohol use does not decrease your risk for heart disease. As much as the winemakers will try to tell you that wine is a healthy thing to be drinking, it is not. The studies actually have shown that it's the grape, not the fermentation. So we've known a lot about this for years, but it's big money. Cigarette smoking definitely increases your risk. And then there's a whole category of things that actually are independent risk factors, meaning if you have one of these things, you're actually considered a risk equivalent as if you already have heart disease. So HIV actually makes you a risk equivalent. So they get put on statins and put on all the heart healthy things and prescriptions, usually as soon as they get that diagnosis for a lot of them. Microalbuminuria is basically something they start checking diabetics for. So it's kind of the minimum to say you've got too much protein in your urine. But that by itself, without you even being diabetic or being pre-diabetic, means you're at risk. You're already there for having a risk equivalent for heart disease. So you need to be doing things to make some changes. Okay. Metabolic syndrome is this fancy term. It's had lots of different names, but metabolic syndrome is also known as insulin resistance syndrome or syndrome X, I've heard it called as well. It's really a combination of things. So it's a combination of you being pre-diabetic and having borderline hypertension and having an elevated or expanded waist, or having blood pressure, cholesterol, so having triglycerides that are high and having the HDL, which is the healthy cholesterol, too low. So those things, if you have 3 of those, you are considered a metabolic syndrome. And then if you've had radiation for breast cancer, lymphoma, various things where it's exposed your body to radiation, the chest radiation will actually increase your risk for coronary artery disease and chronic kidney disease, specifically once you get to stage 3, okay? All righty, and then we're gonna play our first video here as well on how not to die from heart disease from Dr. Greger.
The most likely reason most of our loved ones will die is heart disease. It's still up to each of us to make our own decisions as to what to eat and how to live, but we should make these choices consciously, educating ourselves about the predictable consequences of our actions. Atherosclerosis, hardening of the arteries, begins in childhood. By age 10, the arteries of nearly all kids raised on the standard American diet already have fatty streaks, the first stage of the disease. Then, the plaques start forming in our 20s, get worse in our 30s, and then can start killing us off. In our heart, it's called a heart attack. In our brain, it can manifest as a stroke. So if there's anyone watching this older than age 10, then the choice isn't whether or not to eat healthy to prevent heart disease, it's whether or not you want to reverse the heart disease you likely already have. Is that even possible? When researchers took people with heart disease and put them on the kind of plant-based diet followed by populations that did not get epidemic heart disease, their hope was that it might slow the disease process down, maybe even stop it. But instead, something miraculous happened. The disease started to reverse, to get better. As soon as patients stopped eating artery-clogging diets, their bodies were able to start dissolving some of the plaque away, opening up arteries without drugs, without surgery, suggesting their bodies wanted to heal all along, but were just never given the chance. That improvement in blood flow to the heart muscle itself on the left was after just 3 weeks eating healthy. Let me share with you what's been called the best-kept secret in medicine. The best-kept secret in medicine is that sometimes, given the right conditions, the body can heal itself. You know, if you whack your shin really hard on a coffee table, you can get all red, hot, painful, swollen, inflamed, but will heal naturally if you just stand back and let your body work its magic. But what if you kept whacking your shin in the same place day after day? In fact, 3 times a day, breakfast, lunch, and dinner. It never healed. You'd go to your doctor and be like, oh, my shin hurts. The doctor would be like, no problem. Whip out their pad, write your prescription for painkillers. You're still whacking your shin 3 times a day. Oh, it still really hurts like heck, but oh, it feels so much better with those pain pills on board. Thank heavens for modern medicine. It's like when people take nitroglycerin for crushing chest pain. Tremendous relief, but you're not doing anything to treat the underlying cause. Our body wants to come back to health if we let it, but if we keep re-damaging ourselves 3 times a day, we may never heal. One of the most amazing things I learned in all my medical training was that within about 15 years of stopping smoking, your lung cancer risk approaches that of a lifelong non-smoker. Isn't that amazing? Like your lungs can clear out all that tar, and eventually it's almost as if you never started smoking at all. And every morning of our smoking life, that healing process started to wham, our first cigarette of the day, re-injuring our lungs with every puff, just like we can re-injure our arteries with every bite, when all we had to do all along, the miracle cure, is just stand back, get out of the way, stop re-damaging ourselves, and let our body's natural healing processes bring us back towards health. The human body is a self-healing machine. Sure, you could choose moderation, hit yourself with a smaller hammer, but why beat yourself up at all? I don't tell my smoking patients to cut down to half pack a day. I tell them to quit. Sure, half pack is better than 2 packs a day, but we should try to only put healthy things in our mouths. We've known about this for decades. American Heart Journal, 1977, cases like Mr. F.W. here, heart disease so bad couldn't even make it to the mailbox, but started eating healthier, and a few months later he was climbing mountains, no pain. Now, there are these fancy new anti-angina, anti-chest pain drugs out now that cost thousands of dollars a year, but at the highest dose may be able to prolong exercise duration as long as 33.5 seconds. It does not look like those choosing the drug route will be climbing mountains anytime soon. Right? See, plant-based diets aren't just safer and cheaper, they can work better because you're treating the actual cause of the disease.
So a quote here from, the next slide is a quote from Oh, yeah, it is this book. Okay. Mastering Diabetes. This guy here wrote, unfortunately, many people believe that they inherit their cardiovascular health genetically and make statements like, heart disease runs in my family. The truth is that only about 2 to 3% of the population actually inherits genetic abnormalities that require medication. So really, cholesterol is the only direct or true risk factor. All the rest are indirect. So you control the cholesterol, you control the biggest factor out there, okay? So we're going to talk about cholesterol types here a little bit. So we've got on here the total fat goal a day, which is what we tell, what I tell patients, and what some of these books will talk about when they're talking about actually reversing disease. So Mastering Diabetes is about reversing diabetes, and they actually recommend eating up to 20 or more servings of fruit a day, and the people are able to do that by following a low-fat diet. And not only does their sugars not worsen with all that fruit, it actually improves by far. So total fat is recommended to be less than 30 grams a day. Saturated fat is really is recommended to be less than 10% of your calorie intake. So if you're on a 2,000 calorie diet, less than 200 calories of that do you want from saturated fat. So you can read labels on things. But if you eat animal products, I can tell you, you know, I looked this up for a patient just recently. Eggs are about 1.5 each. Glass of milk, if it's whole milk, 5 grams per glass. Chicken breast, beef, I think it's 4 ounces for beef, 4 or 5 grams of saturated fat. So that would actually give you more than what's usually recommended for a healthy diet. Now the part that unfortunately is that vegans or people following a plant-based diet, if they're eating a junk food vegan diet, coconut and palm oils are in all those fake meats, fake cheeses, fake things that give you the same feel of meat. So it's one of those things that helps you, for some people, it helps them transition from eating a less healthy diet to a healthier diet. But it's not a health diet. So if you're looking at the different diets out there, you've got kind of the standard American diet that has the most health problems out there. Then you've got flexitarians that eat a little bit less, and pescatarians that eat fish but don't eat red meat, so they have a little less problems. Then you've got vegetarians that eat eggs and dairy but don't eat any other animal products. Then you've got vegans that eat no animal products, but they could live on potato chips and Diet Coke. Or you've got whole food plant-based diet down here. And the more you go down that line, the more you're going to improve your health and the more you're going to healthfully lose weight. And it really depends on how quickly you want to get down to that. So some people want to go really gradually and slowly, and some people are like, hey, I just had a heart attack, I'm ready to go there right now. So that's a personal decision for everybody, how quickly, if you want to get health, you know, if you're wanting to get healthier, if you're wanting to do things. Everybody has to make their own decisions about how they do it. Trans fats. So saturated fats, we're going to talk, I'm going to show you a thing here in just a minute, and also trans fats. Trans fats are not recommended in any amount. The way they've gotten away from putting these on labels is they've made things to where the serving sizes are so small. Like if you've got those spray oils, you'll see that it's like 0.8 of a second for a serving. I don't know how anybody does that, but that's so that they don't have to show the trans fats on the label, okay? So our biggest sources of trans fats, the things I didn't bring today for potluck. So cakes, cookies, the next slide. Cakes, cookies, pies, breads, animal products, candies, breakfast cereals, salad dressing, shortening, which, yeah, potato chips, one of my favorites, fried potatoes, and margarine. All right, so this is the biggest, these are the table with trans fat. The next one is the most disturbing because our number one source of saturated fat in this country is cheese. And The other things on the, if you look at this table, if it's big enough, milk is up there pretty high, eggs on there pretty high, poultry, cakes, cookies, quick breads, pastries, and pies. Yeah, more of my favorites, but still. Yeah, so potluck is known, everybody in the health community usually knows that potlucks are known for not being a health thing. They are not where you go to get healthy, it's where you go to share your comfort foods. And yeah, anyway, they're very tasty. But all right, so we're gonna go to the second and third video right now.
Cholesterol and heart disease. Why has there been so much controversy? The scientific consensus
is that lowering cholesterol reduces heart attacks. So why are we still debating whether cholesterol-containing foods affect blood cholesterol? And how do eggs fit in? We look at those questions in this video and the next.
The cholesterol controversy is over. In fact, you can argue it was over a century ago. It seemed obvious in 1920 that high cholesterol levels in the blood infiltrating your artery walls was the cause of coronary heart disease, the #1 killer of men and women, confirmed as unequivocally as the revelation that blood circulated throughout the body, or that the tuberculosis bacteria causes tuberculosis. I've reviewed some of that evidence previously in videos like How Do We Know That Cholesterol Causes Heart Disease? And Optimal Cholesterol Level. The question is, why did it take so long? What is so puzzling is that why we have to work so hard to sell the message, given what seems to be an unbeatable amount of hard evidence. Many rejected the cholesterol-heart disease link because so many patients were dying of coronary heart disease despite so-called perfectly normal cholesterol levels. Of course, as I've detailed before, having normal cholesterol levels in a society where it's normal to drop dead of a heart attack isn't exactly saying much. Ideally, we want to get our total cholesterol well under 150, since having high cholesterol levels in your blood is thought of as the only direct atherosclerotic risk factor. All the other things, smoking, high blood pressure, diabetes, inactivity, obesity, just exacerbate the damage caused by the high cholesterol. Another factor may be the preoccupation of cardiologists with all the new fancy gadgets and procedures out there. It's like we trained them to be highly skilled, high-tech fighter pilots to fight a war, but then sent them on some boring preventive diplomatic mission. But the reasons may be even more personal than that. As an editorial in the Journal of the American Heart Association asked nearly 50 years ago, why do we pretend the cause of heart disease is mysterious? There is no mystery as to why the incidence of heart disease, like that of lung disease and of venereal disease, sexually transmitted disease, continues to rise for many decades after the cause is established. Why? Because human beings, including physicians, are eager for excuses, not to face annoying facts, and so they continue to do things which are agreeable but hazardous. People tend to reject new ideas even when they don't impose any change in our way of life, and it's almost impossible for most men to accept any suggestion that it might be wise to give up agreeable habits such as smoking, unsafe sex, or eating their favorite foods. This continuing challenge is represented by a senior professor of medicine who questioned whether an alteration of diet would really affect the course of heart disease. These professors know the facts. The problem is that they, like so many patients, will not allow themselves to believe the message. Eating rich food just means too much to too many people, even when it's our gravest mortal threat. Scientific consensus panels going decades established beyond a reasonable doubt that lowering LDL cholesterol reduces the risk of heart attacks. Consistent evidence unequivocally establishes that LDL causes our #1 killer, atherosclerotic cardiovascular disease. And what raises LDL cholesterol? Saturated fat. And where is cholesterol-raising saturated fat found? The #1 source is dairy, the #2 source is chicken, then pastries, pork, and burgers. And it's not just saturated fat. Dietary cholesterol has been known as a dominant factor in the genesis of atherosclerosis since 1908, which is why we should lower our intake of saturated fats, trans fats, and dietary cholesterol as much as possible. This is consistent with how our biology evolved. Extensive evidence clearly indicates that a plant-based diet was the traditional eating pattern of our distant ancestors. And so dietary cholesterol intakes were typically very low, while at the same time we were packing in whole plant foods containing components like fiber to help us eliminate cholesterol. Where is dietary cholesterol coming from now? Overwhelmingly eggs, with the number 2 source chicken, then beef, dairy, and pork. So wait a second. If the Institute of Medicine recommends that individuals consume as little dietary cholesterol as possible, presumably that would mean cutting out foods like eggs entirely. But does eating cholesterol actually raise your blood cholesterol? We'll find out next. The question, does egg feeding, in other words dietary cholesterol, affect the level of cholesterol in the blood, was answered 40 years ago. Give someone half a cup of eggs a day, and within 2, 3, 4 weeks their cholesterol keeps going up, and then stop the eggs by switching to an egg substitute, and the cholesterol comes down. Or start people on the egg substitute and not much happens, but then start feeding eggs, and their cholesterol shoots right up. Put people on a cholesterol-free diet, and their cholesterols drop. But then add some egg yolk cholesterol, and their cholesterol goes up. Take it away, and their cholesterol goes down. You could do this all year. And it's within days, 10 days of eggs, and cholesterol shot up 50 points. Take the eggs away, and it comes back down. You can reproduce this effect over, and over, and over, and over, though evidently penguin omelets are only about half as deadly. Switch people from a high cholesterol diet to a cholesterol-free diet, and you can drop blood cholesterol levels as much as 100 points. OK, but that was giving people more than a half a cup of egg yolks a day. But even just a single egg a day can increase people's LDL cholesterol 12%. Put all the studies together in this 2020 meta-analysis, more than 50 randomized controlled trials feeding people eggs, and egg consumption significantly increases LDL cholesterol. Period. Now, studies funded by the Egg Board use a variety of methods to try to minimize the reported negative health effects of eggs by, for example, claiming that dietary cholesterol affects only certain people. That's actually been put to the test, and only 3% were even potentially non-responders to dietary cholesterol, and even these probably evidence some adverse response. Wait, then how was the Egg Board able to design a study in which egg intake did not change blood cholesterol? By feeding them sufficiently large quantities of dairy and meat. See, there's a plateau effect. Though all lines of evidence converge to indicate that dietary cholesterol is a major factor in promoting hardening of the arteries, confusion about dietary cholesterol has arisen because above a certain ceiling you basically max out cholesterol absorption. Check it out. If you're eating a strictly plant-based diet with a baseline of 0 cholesterol intake, and you start adding meat, dairy, or eggs to your diet, you can get a dramatic rise in blood cholesterol. But as your diet starts out more and more meaty, you can saturate your system and basically max out on the additional effect. So no wonder the Egg Board packed in the extra meat and dairy to mask the egg effect. A systematic review of egg industry funding and cholesterol research sought out to see if industry-funded studies were more likely to report conclusions that were not supported by their own objective findings. Of the non-industry-funded studies on the effect of egg ingestion on cholesterol, cholesterol increases were reported in about 90%. Among industry-funded studies, cholesterol increases were reported in about 90%. In other words, even the egg industry-funded study showed eggs increased blood cholesterol. and not a single study funded by anyone showed a significant decrease. Okay, but here's the crazy part. About half of the industry-funded studies reported conclusions that were discordant with their own results. In other words, they found that cholesterol went up, but if you read their conclusions, they exonerated eggs. That's why you can't just read the abstract. You actually have to see what they found. Readers, editors, and the public should remain alert to funding sources in interpreting study findings and conclusions.
Categories of foods that are actually really known for helping cholesterol, with lowering cholesterol, and Brazil nuts is one of them. This has actually been shown to be equivalent of, for a lot of people, if you eat 4 of these, the studies have shown that they've actually stayed in your blood system for over a month, and it's about equivalent of a statin. So while you don't want to eat tons of these things, John, do you need one of these? So 4 of these a month have shown 4 nuts, 4 Brazil nuts, not 4 bags. No, not 4 bags, 4 nuts. Okay, so 4 nuts a month. They've done studies on 4 nuts a month, and it has shown your LDL levels to stay low for over a month after 4 nuts. Okay, so this is an easy thing to try. 1 month. Easy thing to try. How do you eat them? Chew them. Or there's a really good... Yes, yeah, it's a raw nut. You can make it into gravy. You know, John? Yeah, do you know Brian Banos? This is his favorite gravy stuff that I made. He said you could bottle that and I would drink it. So Brian, if you're watching, Brazil nuts. These are ones for y'all to try because it's opened. If anybody needs a Brazil nut, we can pass these around. Brazil nuts. You can make gravy out of it, and it's actually a very good gravy. I've made pot pie with this stuff with the gravy. Okay, so we eat this once a month. You get you all. So these are unsaturated. It does have, nuts do have saturated fat in them, but they also have the unsaturated fat. So they are one of those categories of things that, yes, you do not want to just get a big thing and eat handfuls of the stuff every day. You could eat 2 of these a day and be totally fine. Okay? Companies. This one's opened. So this is Food to Live. I have a lot of, so this one's open. So I thought people, if they wanted to try any, if anybody needs their Brazil nuts and don't know where to find these things, we can pass these around and you can try them. This one's not opened and it was easier to say. Okay.
Are these raw?
Yeah, they're raw.
I don't think I've ever had a raw one.
Help yourself. You can pass them around. All right, so that's one food.
Oh my gosh, you got a lump worth. These are huge. Just two.
Just 2. So they're high in selenium. So here's some benefits of it that we put up here. Good for the brain. They got high in polyphenols. These are some just easy things you guys can do. They're good for thyroid. They're good for depression because if you have low selenium, that actually affects your mood. So I can give you recipes for Brazil nut gravy. I couldn't find them because I boxed up all my stuff this week and I was like, where is it? So 4 per month has been shown to help your cholesterol. So well, I eat more than 4 in gravy because the gravy is more than that, but it probably caps out as well. So my cholesterol has not gone to 0, but my cholesterol has improved quite a bit, okay? So that's one easy thing. And then the previous slide, if we go back to that previous slide, some other foods, oats, I showed you the oats last time. So things that are high in fiber help you as well because they actually they help you digest things. And if you're going to eat an unhealthy meal, the studies have actually shown if you combine it with high fiber and with other foods that like transport it out, you actually eliminate more of it and don't absorb it as much. So keep that in mind, okay? We're going to go back to that in a minute. We'll go back to, but I'm going to go through these other foods first, and then we'll go back to that Brazil nut one because I don't think it. So the selenium, they wanted to know about the selenium is good for prostate as well. So that is a good. So selenium deficiencies have been associated with prostate issues as well. Now there are people that are allergic to Brazil nuts. So if you're one of those, don't eat them. Find something else. But there are other things on these lists that lower cholesterol. So oats are really good. And the less processed things are, the better. Like I was talking last time, oat groats are considered an intact grain or a resistant starch. They are things that actually make your gut really happy. And there's another really good book about that kind of stuff, Fiber Fueled. If anybody has problems with gut intolerance or food intolerances, GI issues with eating beans or other things, this book is really handy, and you can hear him on podcasts, but he's got a lot of recipes in there and how to actually gradually increase things in your diet that you have intolerances to, because usually it's just a matter of your body needing to get used to it and gradually build it up. So if you're one of those, like we're going to talk about beans, beans are one of those things that if you're not used to eating regularly, you probably will get bloated and have a lot of gas and other issues, but that doesn't mean you have an intolerance to beans. That means you need to eat them more regularly. And you may need to start with a tablespoon at a time and gradually work your way up to the 3 to 4 servings a day, which are what's recommended, which is about a can's worth. Okay, so that's the more variety of things you eat, the better, because your gut actually gets that diversity. So each plant, each animal has their own microbiome, which is really shocking. All of our microbiomes in our body are genetically unique to us and us only. So, one of the things they even say about if you have pets, their microbiome affects you, whereas kids that have pets actually have less problems with allergies and other issues. So even birds and horses and dogs will affect your microbiome. So my family all affects my microbiome that lives in my house. Anyway, okay, so other foods, barley and other whole grains that we didn't mention, like farro and quinoa that we had in salad today. Beans is its own category. Soy is its own category. These are soy beans that were roasted. So soy nuts, soybeans, these are actually, you can make soy milk, you can make tofu, you can make tempeh. Tempeh was in that salad out there, the marinated tempeh. That's just fermented soy beans. And then other high pectin fruits are really good for reducing cholesterol. They say apple a day, keeps the doctor away. So beans is the next category we're going to talk about here real quick. Over 40,000 varieties. I brought a few, but there are over 40,000 varieties in seed banks. So seed banks in Europe, they don't allow any genetically modified anything there, so they will keep things in vaults that are pretty unique, and it's a pretty cool thing when you start reading about it. But anyway, beans are very high in fiber and protein. They're high in folic acid or folate, so they actually help reduce risk for neurological problems, spinal cord injuries, things like that. They're high in antioxidants. They're good for heart health, reduce your colon cancer risk. So things that keep you moving are very good for you, okay? So they actually say one of the things you can do for beans or for determining if you're at a higher risk for colon cancer is determining how long it takes you to eliminate things, which the easiest way to determine that is beets or corn or something that you can time from when you eat it to when you see it. And if it's less than 24 hours, that means your gut is actually moving fairly well, okay? Some people, it takes a lot longer than that, and that's usually a sign that your gut's not working so well, okay? Beans, for those diabetics, it really helps stabilize your blood sugar. So having beans every single meal actually helps. So that's why 3 to 4 servings a day, 1 to 2 servings per meal, helps stabilize those blood sugars. Okay, helps prevent fatty liver, improves your gut health, and it controls your appetite because you feel full instead of, filling up on low density foods or low nutrient foods. Anyway, okay, so we got one more video to go, and then we'll take some questions. If anybody has.
LDL cholesterol is a prime risk factor for the #1 killer of men and women, heart disease. But how low should you go? Watch the video to find out. Consistent evidence from a variety of sources unequivocally establishes that bad LDL cholesterol causes atherosclerotic cardiovascular disease. Strokes and heart attacks are a leading cause of death. This evidence base includes hundreds of studies involving millions of people. Cholesterol is the cause of atherosclerosis, the hardening of the arteries, and the message is loud and clear. It's the cholesterol, stupid, noted the editor of the American Journal of Cardiology, William Clifford Roberts, whose CV is more than 100 pages long, having published about 1,700 articles in the peer-reviewed medical literature. Yes, there are at least 10 traditional risk factors for atherosclerosis, but, as Dr. Roberts noted, only one is required for the progression of the disease: elevated cholesterol. Phew, you say, because you just got back from your doctors and your cholesterol is normal. Thank goodness. But wait, having a normal cholesterol in a society where it's normal to drop dead of a heart attack isn't necessarily a good thing. With heart disease, the #1 killer of men and women, we definitely don't want to have normal cholesterol levels. We want to have optimal levels, and not optimal by current laboratory standards, but optimal for human health. Normal LDL cholesterol levels are associated with the hidden buildup of atherosclerotic plaques in our arteries, even in those with so-called optimal risk factors by current standards: blood pressure under 120/80, normal blood sugars, total cholesterol under 200. If you went to your doctor with those kinds of numbers, you'd get a gold star and a lollipop. But if your doctor used ultrasound and CT scans to actually peek inside your body, overt atherosclerotic plaques would be detected in 38% of people with those kinds of quote-unquote optimal numbers. Maybe those ain't so optimal after all. Maybe we should define an LDL cholesterol level as optimal only when it no longer causes disease. What a concept! When more than 1,000 men and women in their 40s were scanned, having an LDL level under 130, which most lab tests would consider a normal LDL, left them with atherosclerosis throughout their body. Atherosclerotic plaques were not found only with LDL down around 50 or 60, which just so happens to be the level most people had before we all started eating this way. The majority of the adult population in the world had LDLs of about 50. So that's the true normal. Present average values should not be regarded as normal. We don't want to have a normal cholesterol based on a sick society. We want a cholesterol normal for the human species, which may be down around 30 to 70, which for those who live outside of the U.S. is an LDL of 0.8 to 1.8 millimoles per liter. Although an LDL level of 50 to 70 seems excessively low by modern American standards, it is precisely the normal range for individuals living the lifestyle and eating the diet for which we were genetically adapted over millions of years, a diet centered around whole plant foods. No wonder we have this killer epidemic of atherosclerosis, given the LDL level our bodies were designed for is less than half of what we presently consider normal. There's an inappropriate tendency in medicine to accept small changes in risk factors, but the goal is not to just decrease risk, but to prevent plaques, period. So How low should you go? In light of the latest evidence from trials exploring the benefits and risk of profound LDL cholesterol lowering, the answer to the question, how low do you go, is arguably as straightforward, as low as you can. But yeah, indeed, lower may be better. However, if you're going to do it with drugs, then you have to balance that with the risk of drug side effects. The reason we don't just drug everyone with statins, like put it in the water supply, is that although it would be great if everyone's cholesterol was lower, there are the countervailing risks of the drugs. So doctors aim to use statin drugs at the highest dose possible, achieving the largest LDL cholesterol reduction possible, without increasing risk of the muscle damage the drugs may cause. But when you're using lifestyle changes to bring down your cholesterol, all you get are the benefits, but can you get it low enough with diet alone? Ask some of the country's top cholesterol experts what they shoot for, and odds are you'll hear something like an LDL under 70 or so. Yeah, we should try to avoid the saturated and trans fats found in junk foods and meat, and the dietary cholesterol found mostly in eggs, but it is unlikely anyone can achieve an LDL cholesterol of 70 with a low saturated fat, low cholesterol diet alone. Many doctors have this mistaken impression. An LDL of 70 isn't only possible on a healthy enough diet, it may be normal. Those eating strictly plant-based diets can average an LDL that low. No wonder plant-based diets are the only dietary patterns ever proven to reverse coronary heart disease in the majority of patients. And the side effects? You get to feel better, too. Several randomized clinical trials have demonstrated that more plant-based dietary patterns significantly improved psychological well-being and quality of life, less depression, less anxiety, better emotional well-being, better physical well-being, and better general health.
The talk. Does anybody need nuts? Janet.
We know that cholesterol comes from more than just what we eat. Our body produces cholesterol. And every cell in our body has cholesterol, and our brain is made of cholesterol. So if we get that too low, what's that going to do to the rest of our body?
So you don't need to ingest cholesterol. Your body can actually make the things it needs for producing those cells. So you're not going to actually get it too low by following a healthy diet, period. So like the study said, there is no such thing as too low on LDL. So statins, so in terms of statins, there are, most people tolerate statins just fine, but everybody responds to medications differently, okay? There are people that do have increased risk of muscle pain with it. It's usually all over, not just leg cramps, which they want to blame it on. It does you usually do need to have a normal vitamin D level with it. So if your vitamin D level is abnormal, you're at a higher risk for developing risks or the complications of statins. Okay, statins really depends on how bad your cholesterol is to begin with, which is where they usually start. When I see a 20-some-year-old that comes in with cholesterol over 300, yeah, I put them on the max dose and tell them, you need to change your diet if you want to get off this, but they don't. They just take the pills, or they stop taking the pills because they're 20 and they say, I'm invincible. But anyway, you know, it really just depends on how bad your cholesterol is. If you have a heart attack or a stroke, they're automatically going to put you on the maximum dose to stabilize those plaques that you already have that are at a risk for rupturing and causing another event. Okay? Any other questions? Bonnie?
Here in the cholesterol, they give you different figures. You've got total cholesterol, you've got HDL,
LDL and triglycerides.
So
So LDL is the bad one. I call it lousy. And HDL is the healthy one. I call healthy. So the HDL, the higher you go, the better. You want that above 50, ideally. And the higher, the better.
HDL, you want it where?
You want it high. So above 50. the better that is. And that can be affected by exercise and other things like that. But that's, in fact, the patients I have with the highest level from alcohol. So my alcoholics with end-stage liver disease usually have the highest HDL I ever see. But they're dying from other things because they're drinking alcohol and they're not eating. Yeah, basically. Okay. Triglycerides, those are affected by your sugars a lot. So if your A1C is up from your diabetes, your triglycerides will be up. Total cholesterol, really the goal is less than 150. LDL, 150 for total is under. Yeah. And LDL, really the goal is to be less than 70. If you've got heart disease where they've put in stents or bypasses, they will try to target you at 70 by getting you on tons and tons of medicines. And they'll get, usually a statin, then you'll get Zetia on top of that, and then they'll get, injectables sometimes on top of that. When these other things that you can do can lower your cholesterol over 100 points without those risks and without the $15,000 cost of some of those injectable cholesterol medicines. Other questions? Yes, you can. So the way we like to put things about the genetic kind of conditions are that it loads the gun and that your lifestyle pulls the trigger. Yeah. So we've had people also with perfectly normal cholesterol levels come in and have heart attacks and strokes. You can still have them, and stress affects a lot of these things too. So stress we cannot manage very well. And doctors we're not good at managing it. We aren't good at taking care of our own stress. Stress is a major factor on a lot of these things that we don't talk about and we can't fix. We can't medicate, so how do we fix it? So stress is one of those things that is that one of those risk factors out there that we don't talk about because we don't know really how to fix it. Besides, people telling you, okay, go meditate, or take deep breaths and count to 10. We're not good at managing stress in this society. Any of us, pretty much. But that is the thing with even the genetics. If you follow those lifestyle and really manage those lifestyle things, your risk is much, much lower. So other questions?
Did you say at all that you're going to say about LDLs? I thought you started to say something about LDLs.
The lower you go, the better.
Lower.
What else would you like me to say? What were you asking? You have a question on that? It's what do you mean? What's a characteristic? It's the bad one. Comes from your it comes from your saturated fat. So it comes from the things you eat. Those saturated fat have a direct correlation to your LDL. So that slide we showed that has the cheese and the eggs and the pastries and the donuts and the those kind of things that I really like. Donuts. Yeah. So I'm one that I lived on eggs growing up. I did not like cereal for anything. I would not eat cold cereal. I had a fried egg and cheese sandwich most days, and triples if I could get away with it. Most days because I hated cereal growing up. My sister would eat the whole box, and I would be like, no. So I didn't like hot cereal really either. So I was a pretty picky kid. And eggs, I could eat eggs. And yes, I ate a dozen eggs in one setting as a 5-year-old. How old was I? And I didn't think anything of it. My aunt was boiling eggs for deviled eggs for probably a derby party or something. And she left them in the pantry to cool. And I got them and ate them all. So eggs were one of those things that I had a hard time giving up. Eggs and cheese. Those were my two favorite because I ate a lot of them. And my cholesterol was high in my teens. In my 20s, I was put on statins. And I remember telling one of my friends in Lexington, like, I will take statins the rest of my life if it means I can keep eating this stuff. And then I saw videos about, so the videos about health are not what changed me. They made me eat a little better for a little period of time. Me personally, it was the animal cruelty. So I saw one video that just gutted me. I mean, yeah. I cried so hard with that movie. What was it? Earthlings. Earthlings. I watched Earthlings and Meet Your Meat that Alec Baldwin did. It was a 12-minute clip, and I cried so much. I'm such an animal lover. To find out that male chicks are ground up alive as babies because they're male and they're not going to make them money, gutted me. I was sick to my stomach. I cried watching those babies being gassed or put live into a grinder and fed back to the other chickens. I cried. Dairy cows being kept pregnant and their baby being taken away from them and not even being able to feed their baby so that we could have their breast milk, and being kept pregnant by a person so that they can produce those hormones that keep the pregnancy going and keep the milk producing. Watching those little babies that were being taken away to be made into veal, I sobbed. So it was that like that, I was done. So the health things, yes, they got me talking about it more, but the animal stuff, it was immediate. I'm done. And I haven't gone back. So if I ever have to be reminded, I watch those videos that make me cry, and it makes me want to vomit, and I say, I'm good taking care of my baby birds, and I'm not going to let anybody feed them other bird parts, that they say to feed them as part of these little bird diets. Anyway, so any other questions?
Chandra, what do you think about use of Bonjour?
So all these medications that are for the diabetic medicines that are supposed to help you lose weight as well. Yeah, so they all have a, yeah. Yeah, they've actually caused a shortage on the medications for diabetics. So the thing with all these medicines, they have a very high price point on them, and you have to continue to take them to continue to have the effect, okay? And because the studies are not done for decades, they really don't know how long these things are going to be safe for people to take. So usually until medications are out for several years, we don't get all the reports back about all the things that they're causing down the road. Even so, talking about like supplements and things like that. We talk about, FDA does not regulate the supplement industry whatsoever. Not at all. So anything off the shelf that is a supplement can be anything whatsoever from somebody's backyard. They can claim whatever. They have done tests to show that it actually has things in there that are allergens that cause people to have problems. They have found asphalt in supplements. They have found all sorts of things, and there is no regulation. So until somebody is harmed for 7 to 10 years, harmed, death cases, the FDA does not investigate. So if you are needing a supplement of some type, Google the foods that are high in it, okay? God produced our vitamins and minerals in packages of things that are balanced. Balanced vitamins do not come out of a bottle, okay? So when you get like a vitamin E tablet, you're getting one form of the 9+ varieties that are out there in nature that are balanced when you eat them. And when you eat one form, it's out of balance with the other ones that are keeping it in check. And they've actually shown harm with vitamins that they used to recommend all the time for people for prostate health, like vitamin E. And they're saying, no, do not take these supplements. Find the foods that are high in them, eat those. And ideally, plants, because those are the things that reduce your risk. Okay. What other questions?
They said CoQ10 would help.
Yeah. Yeah.
Is there something you can eat in place of that?
I would Google it. I can ask Siri. Where's Siri? Where's my phone? They probably have their phone. They can ask Siri. I usually look up, if patients, when they come in and ask me, I Google it right then on the computer and show them the screen and say, these are the things you can eat that will help you. Because there usually is something, but I would, off the top of my head, I don't remember that one. So, but I know I've looked it up before and told patients, but I just don't remember off the top of my head. Do I also I'll always trust Google? Not always, but if it's a food, what are you harming by trying it? If it's for a medicine, yeah, I usually look at multiple sources. But if it's for a food, what's the harm of eating some grapes? I mean, so anyway, the goal that I tell my patients usually regularly, the foods that are known for healing you and keeping you healthy are plants. The recommendation is 9 to 12 servings of fruit a day. 9 to 12 servings of vegetables, with 2 of those being green leafy vegetables, which is a bag's worth of salad. That is 2 servings. It's about 50 calories. Okay. 3 to 4 servings of beans, split peas, or lentils a day, and 3 to 4 servings of whole grains. So that can be brown rice pasta, whole wheat pasta, red lentil pasta. John, that's all right. You can gag all you want, but any type of bean, any type of grain. So barley, quinoa, wheat, 100% whole wheat bread counts as that. What is a serving? It's a good question. So usually, it depends on how you're weighing things. A serving varies by the food you're eating. So you can Google it. You can ask. You can look up. Michael Greger's got this How Not to Die actually has an app where the app will tell you the daily dozen foods, and it actually has in metric and in ounces the serving size of foods that are recommended. So I have a scale because I'm a baker. So that's the easiest way for me to look at things. So when I do berries in the morning, it's a big bowl. It's usually a pound's worth of berries. And it's multiple different berries, in one big bowl. So that's a lot of berries, but they're good for you. And they're high in fiber, and they have antioxidants. They help your brain power, and usually in the morning, I usually need it. So what other questions?
Chandra, how would you become a patient with a BMI less than 18, the total cholesterol of 200, keep them on statin right away, or do you tell them to do?
I would probably talk to them about what they're eating, where they're getting their sources of fat from, and try to switch them to nuts and seeds, because those are very caloric, but they're actually unsaturated fats, high in unsaturated fats. How long would it take me to decide if I would put them on a statin? So the BMI does not determine whether or not I put them on a statin at all. Because I have a lot of young, thin ones that I put on statins. So that does not determine. But, if they're trying to gain weight by eating high fat. So when I was in med school, I actually lost so much weight that I looked sick. And my doctor told me to start eating butter and cream. Which I did. I did. That's where those statins came in. But anyway, so, the healthier way would have been like start eating nuts and seeds and, pumpkin seeds and sunflower seeds and hemp seeds and, Brazil nuts. So ideally raw, okay? And part of the reason too is, and this is what from the book How Not to Diet. He's got a book called How Not to Diet. It's actually pretty good too. So nuts, when they're roasted and when they fracture, when you chew them up and break them down, they actually break down into smaller pieces than raw ones do. So you end up absorbing more and getting more of the calories absorbed. So if you eat raw ones, they break down into bigger pieces and they are eliminated more of it. Okay, so you don't absorb as much of the nuts and the fat. Okay, plus when they're roasted, it's usually with oil. and then salt on top of it. So yes, raw is usually better. All right, any other questions? All right, anybody else need soy nuts or Brazil nuts? We're all done? All right.